when you think about kind of your hopes in future applications, what are some of the hurdles that you think that this new system is going to help people overcome specifically?
Yeah, that's a very good question. So, for example, one simple scenario we can think about is when MS patients visit their clinicians and neurologists, simply telling them how they measure their steps across the day. For example, I've increased my daily steps for 2,000 steps in the past week. That represents an increased activity level, first of all, as well as for peak cadence. We can tell the patient have increased 20 steps per minute for their walking cadence, for their walking intensity. That's the best representation of how fast they can walk compared to 6 months before. I think it's a very useful and understandable as well and easy to measure outcome that they can use to represent their real world walking
Mm,
in their daily living instead of those one-time assessment conducted in the clinical settings,
mm,
which doesn't really reflect their natural movement. Yeah.
mm. Uh, Staying on the clinical topic for a second, what are the minimal detectable change and minimal clinically important different values for daily step and peak step cadence, and how should these thresholds be interpreted in a research setting?
Yeah, that's a very good question. I'm glad you asked. So the minimal detectable changes we provided at the confidence interval of 90% and 95% confidence interval, we can interpret that threshold as the real change beyond measurement error. For example, I conducted intervention of
Mm,
disease modifying agents or medications or exercise interventions, for example, 4 months to 6 months where our participants increased their daily steps over 2,000 steps, or their peak cadence increased over 20 steps per minute across the whole monitoring period. That means these changes would reflect the real improvement of their walking behavior instead of the measurement error or natural fluctuations across those time
mm,
period without intervention. If that makes sense.
mhm.
Yeah.
Are step-based metrics are these sensitive to subtle changes in walking performance or disability that could be missed by conventional clinical-based measures? And what is the sensitivity compared to the regular system versus what you're proposing?
Yeah, that's a very interesting question. So, in our comparison between those lab assessed measurements, such as 6 minute walk, we found that their measurement error is typically within 10%, which is what we kind of expect that would happen in a clinical setting. The environment doesn't change, and participants should perform similarly at two different time points without intervention. But for step-based metrics, it's naturally measured and collected data from the real world that's subject to changes of environment, seasonal changes and weather, and participants' performance across the day. So there are more natural fluctuations or potential errors over time due to a lot of factors. So there are a little bit more higher errors, measurement errors could be, but we think overall, based on the statistic, based on the data we have, they're quite stable. They can reflect walking performance while considering, while accounting for these natural fluctuations. So if the changes because of intervention is over that minimal detectable changes, we can consider that as real change and real improvements or declines over time.
Mm.
Yeah.